Good morning to you. Welcome to Talking Pittsburgh. My guest today, Kate Licious. She is with the Beaver County Behavioral Health, Drug, and Alcohol Program. Thanks so much for joining us today.
Thank you very much.
Before we get started on about a specific part of your program, give me an overall view of what you all do.
We're called a single county authority, and throughout the Commonwealth of Pennsylvania, there are 49 single county authority entities. And we are the recipient of the federal and state block grant funds, charged with the responsibility for setting up substance abuse prevention, intervention, and treatment services for all of the citizens of Beaver County.
And you do that in a lot of different ways.
Yes, we do. We do. We provide drug and alcohol assessments at our office. We also have a full continuum of care in place for people who are in need of substance abuse treatment. So that could be outpatient services, detox services, hospital-based treatment. So there's a wide array of programs that we fund and support and oversee, including drug and alcohol prevention programs.
And which is what we want to talk about today. I think this is such a unique way to go about this. It's called the Reality Tour.
Yes.
And you are targeting a specific age group. Tell me what that is and why it's so important.
The age group that we target are children ages 10 to 14 primarily. This program is very unique. It's unlike most drug prevention programs in that all children are required to have a parent attend with them. And the reason for the age group is, unfortunately, we're learning more and more that the age of first use among youth is getting younger. We see some federal studies have indicated that some children use drugs as early as 8 or 9 years old. So we want to strike while the iron is hot. We want to reach children and their parents before they have really descended into substance use or abuse or penetrated the criminal justice system. And what's really unique about this program is it's a co-learning experience for both the parent and the child. So unlike a school curriculum where the information is only presented to the child, both the parent and the child are observing and experiencing the tour at the same time and hearing the same message. And that promotes further discussion and dialogue long after the tour has been completed.
I love that. Now, I was reading a little bit about the tour, and it says you want the tour to allow teenagers or preteens in this situation as well to find out what it's like to do the time before they do the crime. And how are you doing that?
Well, the framework of the reality tour is a series of dramatic scenes which are acted by a whole host of community members who have chosen to volunteer for this program. We have a peer pressure scene. We have the simulation of an arrest of a young person in the audience for possession of drugs. We have an incarceration scene, an emergency room scene where a child has overdosed, and then ultimately a funeral scene where the members of the audience are invited to process through the line at the funeral and meet the family. So the audience is experiencing in real time the progression of negative physical and emotional consequences around this victim who is involved in addiction on heroin. So prior to each dramatic scene, there's a narrative where you hear the voice of the victim talking to the audience and explaining the series of consequences which led up to this scene that the audience is about to view.
It's really powerful.
It's very powerful. The scenes deliver a really high impact, and throughout the evening, in addition to the scenes, we're also providing a lot of information, activities, resources, and opportunities for the child and the parent to set goals for themselves, to come up with some strategies, and to build in some protective factors so that hopefully the children who are attending do not have the same fate as the victim who's being depicted.
Now, has this been done in other parts of the country? And what's the reaction that kids from 10 to 14, what do you expect for them, what kind of reaction do you expect to get from them?
It has been presented throughout the country. It was developed in 2003 by a woman named Norma Norris from Butler, and the parent company of the reality tour is Candle Incorporated. So the program model has been studied by the University of Pittsburgh School of Pharmacy. It has expanded to 30 30% of the counties throughout Pennsylvania and now 8 states.
Wow.
So a lot of the outcomes that we're getting, the information that comes back to us from parents and children, or this has encouraged me to want to spend more time with my child. I need to monitor my child's activities more. We had a 16-year-old girl who had already been using marijuana on a regular basis, and after attending a tour she said, I never want to do that again. We've had kids say, this is a miracle, this is amazing, we're so grateful.
It's interesting, the parents also seem to be getting you're getting a huge reaction from them, not just the kids who you're targeting, which I think is key in making this all successful.
Absolutely, absolutely. It's a collaborative effort, and we really tap into the potential that parents have to really impact upon their kids and help them make better choices for life.